We are back with an NBC News investigation about the safety of our nation's frontline workers and new questions surrounding those N95 masks that are being decontaminated so that they can be worn over and over again.
So since the beginning of the pandemic, hospitals have been dealing with these ongoing shortages of the masks. And NBC News' investigative and consumer correspondent Vicky Nguyen has more on what has some nurses so concerned right now.
Thousands of nurses nationwide sounding the alarm about reusing N95 respirators.
And this is what we're supposed to feel protected in.
Rick Lucas is a rapid response nurse in Ohio and takes care of some of the sickest COVID-19 patients.
It's so unsettling and so disheartening.
To combat ongoing mask shortages, his hospital and others across the country are taking unprecedented action. They're reusing N95 masks after decontaminating them with chemicals or UV light. A September study of more than 21,000 nurses found that 58% are required to reuse their N95 masks, and 53% say using decontaminated masks makes them feel unsafe. At Lucas's hospital, nurses are told to reuse their N95s 5 times before they're decontaminated.
What's the condition of these masks when they come back to you to be reused?
There's 2 elastic bands on the back. They sometimes break really easily. They'll just snap. They come back stained.
Lucas sent NBC News pictures of what he says are N95s that have been decontaminated. He says they're still visibly soiled and says they no longer fit securely. In a statement, Lucas's hospital told NBC News that any masks that are dirty or damaged after reprocessing can be thrown out.
The study started with a question of, is this mask safe?
Richard Peltier studies exposure science at the University of Massachusetts.
What were some of the key findings of your research?
Some methods do damage masks and others don't.
Peltier showed us his lab where he tested 80 masks that were decontaminated by methods including UV light, hydrogen peroxide, and bleach.
So the more particles that get through represents the more virus that can get through.
That's exactly right.
Peltier says repeated decontamination can break down a mask, and it's not always obvious.
These 2 masks look identical. They feel identical. I can't see any visible damage.
Right. It's dangerous. Healthcare workers who are grabbing these off the shelf don't have the time or ability to evaluate whether the mask is functional or not.
Peltier and the largest nurses union in the country say they're concerned with a decontamination method created by a company called BATTELLE, which uses vaporized hydrogen peroxide to decontaminate hundreds of masks at a time. BATTELLE offers one of 12 decontamination methods given emergency authorization by the FDA. It's the only company to get a federal contract. That contract, worth $400 million, allows BATTELLE to offer their services for free to hospitals.
I've spent a lot of time looking at BATTELLE's materials.
Jane Thomason is an industrial hygienist for National Nurses United and specializes in health and safety. She reviewed multiple public studies on decontamination methods, including BATTELLE's. She says healthcare workers have reported problems linked to BATTELLE's decontaminated masks.
They report respiratory impacts. They report skin irritation, even approaching the level of chemical burns.
The FDA sent BATTELLE a warning letter saying the company hasn't been properly reporting adverse events. BATTELLE declined to be interviewed on camera, but said in a statement the complaints they've logged are a fraction of a percent of the 3.2 million masks they've decontaminated. The company says it has conducted numerous studies and found no issues with fit or performance, and that masks can be decontaminated more than 50 times and still be safe. El Paso, Texas nurse Yvonne Hoppus says BATTELLE decontaminates about 200 masks a week at her hospital, and so far, no issues have been reported.
Doing the decontamination process with BATTELLE is extremely beneficial to not only maintain appropriate levels for PPE, but also to give a level of confidence for your workforce.
Meanwhile, Peltier says BATTELLE declined to provide samples of its masks to be tested. He managed to test some that he obtained from healthcare workers, but says the sample was too small for meaningful results.
We don't know if they're going to fail right away or fail over time. And as scientists, we have to protect those who are putting themselves in harm's way.
National Nurses United says it wants to use plastic respirators that were designed to be reusable and cleaned instead of these decontaminated N95 masks. Meanwhile, BATTELLE tells us they are working with the FDA to address the issues that were raised in that warning letter. The company says this process was always intended to be a stopgap measure until supply chains for PPE returned to normal. By the way, Peter and Kristen, we did reach out to the 3 largest makers of N95 masks. They all told us that these N95s were made to be single-use products. Kristen and Peter?
All right, Vicky Nguyen, thank you. What an important report. It is hard to believe that this many months into the pandemic, we are still talking about frontline workers reusing masks.
This is the conversation we had in March, and the idea that it's November, December, and we're still talking about it. It's really concerning. More needs to be done.
Really is. All right, Vicky, thanks for that.